Guys, well, I just got another email from a TCL viewer. I still get them regularly asking me if I'm happy with my Lasik surgery that I had. Of course, I said, yes, I'm so thrilled with it. I love it. See, no contacts, no glasses. And today, the doctor who performed my surgery is back with us to talk about the leading cause of blindness in Americans under the age of 65. But the good news is we're going to tell you how you can keep your eyes seeing clearly. We want to welcome Dr. Lobanoff from North Suburban Eye Specialists. Hi, Mark.
Hi.
Nice to see you.
It's great to be back.
See, when I say nice to see you, I can really see you so clearly. I really did. I just got another email. I forward some of them to you that people always, and people ask me, even just out and about, how my eyes are doing. And I said to this one guy that for the first couple months, I used eye drops, and then now I'm really not even using them at all anymore.
And that's typically what we find after LASIK is the first couple months, the eyes are a bit dry. You're still using the drops, but by now, you're almost a year out, so you don't need them anymore.
Am I really?
You're getting
close. That was that long ago. That's
right.
Fantastic. Okay, but we want to talk about what I mentioned, the leading cause of blindness in Americans under 65. What is it?
It's diabetic retinopathy.
Wow.
And unfortunately, here in the United States, as the population in the United States gains weight, diabetes becomes more and more prevalent. And unfortunately, over time, diabetes can damage the delicate part of the back of the eye, the retina.
Well, and I think there's a little bit of a misconception that people think, oh, if you get diabetes, you just take insulin shots and you're fine. It's not that big of a deal.
That's right. And it is very important to do that. It's important to control your blood glucose. But it's also important to have us monitor the back of the eye to make sure that these changes are not occurring.
Okay, so what's happening here?
What we're seeing here is damage from diabetes damages the small blood vessels in the retina. And as those vessels are damaged, they leak blood and fluid. They cause swelling in the back of the eye. And originally, this is temporary. It can be more severe. You can get blood vessel growth, and these blood vessels are abnormal. They can cause scarring.
They look kind of scary.
They are scary, and they can lead to blindness, unfortunately.
Wow.
So this is really what we worry about in our patients who have diabetes.
So what do you do to protect your eyes if you have diabetes already?
Well, we're going to show a little short video here on this. Probably the most important thing is controlling your blood glucose, making sure the diabetes is under control, controlling your blood pressure, making sure that each year you go see the eye doctor and that they can take a good look at the back of the eye, make sure these changes are not occurring. And if you do have the changes, we can use a laser to correct it. We can seal those leaking blood vessels, cause those abnormal blood vessels to go away, and stop the damage before people lose their vision.
Wow. So you get in there, and what's that doing?
This is the laser, and so we use the laser to, again, target those areas where the blood vessels are damaged from the diabetes, they're leaking. We can seal the leaks with the laser and fix the problem.
Is this the same laser that you used on my Lasik, or is it a different thing?
That's a great question. It's a different laser. We have many different lasers for different uses. And the laser we use for you for Lasik, it's known as an excimer laser. This one's a bit different. It's known as an argon laser.
So you just go in there and zap them.
Come in, we can treat it, we can get it under control and preserve people's vision.
Wow, that is incredible. But I'm sure you think, too, when you look at people's lifestyles and thinking, you know, we say as the Americans gain weight, you have some control over that. Try to think of this as part of the problem of diabetes.
That's exactly right. And it's important for people who have diabetes to take responsibility for that and to work and control it. And control their weight, look at their diet carefully, work with their doctor to control their blood sugar, keep the diabetes under good control.
That is good. Okay, so how's the Lasik going, though? You're doing more people?
We are. We're very busy.
Everybody's very happy?
Very happy. We're about to open a new Lasik center in a few months.
Are you really?
Yes.
Because you guys have your Blaine and your Coon Rapids spots.
That's right.
Where's the new one going to be?
Well, the new center is going to be in the Blaine location.
Okay, this is very good.
Very
Dr.
exciting.
Lobanoff, thank you so much.
You're very welcome.
North Suburban Eye Specialists, of course, is a sponsor of Twin Cities Live, and again, locations in Blaine and Coon Rapids. And if you have a question for Dr. Lobanoff, head to KSTP.com, click on Twin Cities Live, and then exclusively on TCL to email him. And if you're thinking about getting Lasik, you know, lots of people send me an email and ask, and I'm happy to tell you what I think about it. It was great. So thank you.
We appreciate that. Thank you.
All right, coming up, Heat Things.